Stroke is a disease that almost everyone is afraid of, but not everyone knows what needs to be done to prevent it. I'm Dr. Vasyl Chaika, and today we're going to talk about stroke. What are the first symptoms of a stroke? How can you distinguish one type of stroke from another? And what should you do to avoid this disease? So, a stroke is an acute disturbance of cerebral blood circulation. From a medical point of view, there are two reasons why this can occur. The first reason is when something suddenly blocks a blood vessel that supplies blood to the brain or a part of it. In this case, what is causing the blockage? For example, it could be a blood clot that breaks off, or, from a medical perspective, an atherosclerotic plaque. And a significant contribution to the development of this particular theory was made by the German physician and inventor Virchow. He said that it is not inflammation of the vessels that is the cause of development of the so-called ischemic stroke, when something blocks a vessel and blood no longer flows to the brain tissue, specifically a clot, or as he also called it, an embolus. And there is another type of stroke called hemorrhagic. This is when it is believed that a vessel ruptures, blood escapes beyond the vessel and mechanically compresses, in this case, the brain tissue. And this leads to the disorders that we will be talking about with you today. But is it possible to distinguish one type of stroke from another without having any specific medical knowledge? Of course, it is possible, and we will talk about this further. The risk factors for why both types of strokes occur in medicine, according to official data, are as follows: being elderly, that is, over 60 years old, high blood pressure, heart disease, diabetes, smoking, and also occlusion, which is also called stenosis or blockage of the carotid arteries. That is, if a person has such conditions, then in that case they are more likely to have a stroke. But here there is a very interesting peculiarity. The thing is, neither age, nor high blood pressure, nor vascular blockage have anything to do with it. You might say, wait, how can that be? Does such a situation really happen? Yes. And so in 1999, a study was published in the American Journal of Neuroradiology by a researcher named Barry. What did he find? And his research group. They observed that only a small portion of patients with stroke have severe carotid artery stenosis, and that many elderly people also have carotid artery stenosis, severe. There is no correlation with the risk of stroke. That is what is often detected on ultrasound, that you have a narrowed vessel, for example, the carotid artery blocked by an atherosclerotic plaque, and that this is a risk factor for stroke, and that you are elderly, which is also considered a risk factor for stroke. There is no correlation, meaning there is no dependency. This is simply a myth. Another very important point is the belief that it is high blood pressure that leads to a stroke. This is also a myth, and you can see this because there are many people who have high blood pressure and never experience a stroke. But there are also many people who have normal blood pressure and still experience a stroke. So why does a stroke actually occur? Let's analyze this together from a comprehensive approach. From the perspective of a comprehensive approach, the cause of an ischemic stroke is biological shock. It is precisely after a biological shock, that is, an event that is unexpected, negative, and isolating for a person, and the essence of this event in the context of what we call a stroke should be, I can't do something, or I failed at something, that the sympathetic nervous system is sharply activated, triggering the condition we refer to as a stroke. It may manifest as muscle weakness on the right side of the body or on the left side, and paralysis may also occur. But why is that? Let's break this down with some examples. So, for example, there is a man who has a daughter. The father made arrangements, since he had the financial means, for his daughter to be admitted to the university without taking the entrance exams. They arrive for enrollment, but when the names are read out, her name is not on the list. And at that very moment, when her name was not on the list, the father experiences a biological shock. The essence is, I failed, I was promised, but I failed. And this leads to a sharp activation of the sympathetic nervous system. It is precisely the core of the reflex, I failed, I couldn't see this action through to the end, that leads to the paralysis beginning specifically on his left side. Now the relevant question is, why specifically the left side and not the right? And we already know the answer. If a person is right-handed, and this is very easy to check, for example, by picking up a child in your arms. If the child's head is resting on the left arm, then the person is right-handed. If the child's head is on the right arm, the person is left-handed. So if a biological shock occurs, the essence of which is that I couldn't cope and it's related to the child, then the left side will react. That is, paralysis, numbness, and all changes will occur specifically on the left side. If a person is left-handed and this situation is related to children or to their mother, then it will be on the right side. The reaction occurs on the right side of the body. Another example, also for oneself. A woman who is left-handed, her mother was admitted to the hospital. The daughter did not know about it. She received a call and was told that her mother was in the hospital and in serious condition. Before that, her mother had called her for 2 days, asking her to come, but the daughter didn't have time. She was busy at work. And now comes the news that her mother is in the hospital in serious condition. I couldn't handle it. I didn't listen to my mother. I should have done it that way. For her, it was a biological shock. This happened while she was on her way to the hospital. She was developing a condition that is called a stroke. So what symptoms do people experience when the sympathetic nervous system is activated? First of all, of course, blood pressure increases. This is the activation of the sympathetic nervous system. Secondly, the extremities become cold. Why is adrenaline, noradrenaline, and cortisol released, causing capillary spasms? A person becomes pale. And certain disorders occur. This is lethargy. Weakness or numbness appears in the arm. These are signs of an ischemic stroke. It occurs, I repeat once again, when biological shock happens. As soon as the biological shock subsides and everything normalizes, the functions gradually recover. And of course, as we've been told, an ischemic stroke is much milder than a hemorrhagic one. So what exactly is a hemorrhagic stroke from the perspective of a comprehensive approach? It does not occur due to biological shock. It is not related to it at all. It occurs because it is swelling of the brain tissue, which happens during the healing process. This situation most often arises when the centers of the bronchi, the larynx, the coronary arteries, and the coronary veins are involved. The swelling occurs during the so-called vagotonia. It is significant and it begins to mechanically press on the motor cortex. And therefore, if we are talking about a hemorrhagic stroke, its manifestations will differ from those of an ischemic stroke. Because with a hemorrhagic stroke, the person is completely red, they experience vomiting, their limbs are warm, and their skin is not pale. This person will have a severe headache. Why do all these symptoms occur? Because swelling develops at the level of the brain. And the reason for this swelling, as we already know, is that at the peak of the healing phase, a condition arises that we call an epileptoid crisis. This is a biological process necessary for the completion of recovery and for the water to leave the tissue. And it is precisely during this period that a condition called a hemorrhagic stroke can occur. It's not blood that leaks out there, it's swelling that occurs. Examples of hemorrhagic stroke are specifically those associated with swelling. For instance, before this, the person had a cough, what was called bronchitis. Or for example, there was a stabbing pain in the heart, what is called a heart attack, and then a stroke occurred. What is this related to? You already know the answer to this question. It is precisely the healing response of these centers with significant swelling that leads to mechanical pressure on the motor cortex. Now let's go over how we can quickly check if a person is really having a stroke. You already know the difference between ischemic and hemorrhagic. But there is a very simple rule. To check whether a stroke is developing or not, we use a very simple test. First, we ask the person to smile. When a person smiles, the corners of their mouth should rise evenly without any distortion. For example, one side drooping while the other lifts. Everything is fine. Next, we ask the person to speak, to repeat a phrase. If they start to stutter or cannot repeat the phrase, or speaks incoherently, or does not understand what they are saying, this can also be a sign of a stroke. And the third option, we ask the person to raise their arms. If, for example, there was no injury, yesterday they could raise their arms just fine, but today one arm goes up higher than the other, this also indicates that a stroke may be occurring. That is, when these three positive symptoms are present, which may gradually develop or may appear suddenly, this raises suspicion of a stroke. All other symptoms are considered additional. People often say, oh, there's neck muscle rigidity. Someone else says, oh, there's a headache. Someone experiences weakness in the arm. All of this can happen, but the simplest, easiest, and quickest test is the one I already mentioned to you. There are some specifics. When speech is impaired, you should also be aware of this. This most often occurs, of course, with ischemic strokes, which specifically affect the left hemisphere of the brain. Here on the left side, right here, practically in front of the ear, where the sensory and motor cortex meet, is the so-called Broca's area. It controls the muscles of the larynx and the vocal cords. That's why when this area is affected, it becomes difficult for a person to speak. Speech becomes slow, but an important point is that we can still understand what the person is saying. But there is another area that is responsible for actually comprehending your speech, for understanding language, and it's called Wernicke's area. It is located not in the motor part of the cerebral cortex, but in the sensory part. It's also located here on the left, practically near the occipital region. When this area is affected, a person does not understand what they are saying. And in addition, they mix up words. A vivid example of this, you can now watch a short video where a reporter, when she started developing "thank you" and an ischemic stroke, her speech started to break up.
I am currently in the process of verbalizing my thoughts and conveying information to you at this precise moment in time.
So, if we talk about stroke prevention, you'll often come across advice like you need to eat certain nutrients, or eat a specific product, or, for example, engage in intense exercise, or practice breathing techniques. There are so many recommendations, but in reality, none of these recommendations actually affect whether you will have a stroke or not. You can do special sports, cold water swimming, fasting, eat properly, but still end up in a state of biological shock. And you could still have an ischemic stroke. So what should you do then? How can you really prevent a stroke? You need to understand why it happens, just like we discussed earlier. And as soon as you suspect that you are in a state of biological shock, if you find yourself in an unexpected negative situation, you need to get out of it quickly. The faster you get out of it, the less severe the stroke will actually be. How should you get out of it? The first thing you need to do is to quickly calm down your sympathetic nervous system. Understand that yes, I am in a state of biological shock, some unexpected negative situation has happened to me, but am I dying from this? At this very second, when it happened, am I dying? No, I'm not dying. So in my life, there is no real threat. For example, I was fired from my job, or something happened with my wife or my child or with my surroundings, but am I dying at this very second? No. When you understand this, then you can already use additional methods, such as breathing, massage, physical activity, going for a walk, to regulate the activity of the sympathetic nervous system. Without understanding this, other methods don't work. But when a stroke has already occurred, you already have changes, there is paralysis, there is paresis. At this point, only rehabilitation works, and it must be comprehensive. It's not just physical exercises, stretching, massages, or acupuncture therapy, no. It's a comprehensive approach involving a physical and medical rehabilitation doctor, an occupational therapist, a speech therapist, and a social worker. In other words, it's a team effort to help this person return to life. Why does this rehabilitation work? Because our brain has a phenomenon called neuroplasticity. If you once learned how to write, but after a stroke, for example, you experience impairment and find it difficult, the brain doesn't learn to write from scratch. You can regain this ability. And that's what rehabilitation is for. So once again, if there are already consequences, in this case, a rehabilitation specialist works with them to prevent them from occurring, learn what biological shock is and how to stop it.